At a crucial juncture when the nation is set to go into lockdown 2.0, we are still battling with the number of cases increasing, and so are the number of deaths. In some big news that we're tracking at the moment, there seems to be one more death in Kalaburagi due to COVID-19. Patient number 205 succumbs to the pandemic. The patient was a 55-year-old male with travel history to the national capital. In fact, this very patient, number 205, who's lost his life, came in contact with Markaz attendee. The deceased suffered from severe acute respiratory illness, or SARI. The deceased was on ventilator support for the last 2 days, and with this, the death toll in Kalaburagi has risen to 3. The number of deaths in Karnataka is at 7, so almost half the number of deaths reported in the state so far are from Kalaburagi. Patient number 205, the third casualty in Karnataka due to COVID-19, had a travel history to the national capital, and it is being reported, as per our sources, that patient number 205, who succumbed to the pandemic, came in contact with a Markaz attendee. More details will be sourced for you, and we shall update you with the latest as and when we get details. But yes, another death reported from Karnataka. Now the death toll in the state is at 7, and out of the 7, 3 are from Kalaburagi itself. For more on this, I'm being joined in by my colleague Pratibha on the phone line. Pratibha, it is shocking indeed that you have 7 deaths, out of which 3 are from Kalaburagi itself. And we're talking about yet another death due to, yet another case at least, due to the Markaz convention in the national capital. What more details do you have for us?
Absolutely, Adarsh. Now, this is the information coming in of patient 205 who had tested positive. He was in the ICU over the last 2 days as well, and he had tested positive for COVID-19. This is another death, like you mentioned, related to the Nizamuddin Markaz that had taken place in the national capital in violation of the lockdown. More importantly, this patient was also suffering from severe acute respiratory illness. Now, that puts the patients at a higher risk, or is something that is seen in the patients in the last stages of COVID-19 as well. This has been seen as something that has been extremely worrying for the health department officials as well. This man is said to be an attendee of Nizamuddin Markaz. He was also in contact with the others who had attended the Nizamuddin Markaz. So he had initially shown symptoms, after which he was taken to the hospital. He had tested positive. Over the last 2 days, his condition had been worsening. He was on ventilator as well. So his situation was quite bad. But more importantly, the health department officials now are concerned about the severe acute respiratory illness, because these cases have been on the rise. Of course, in this case, he was an attendee of Nizamuddin Convention, but there have been an increase in the number of cases of people who have not had any travel history. They don't know where they have contracted COVID-19 from as well, but they are suffering from the same. So this is something that the health officials are trying to look at. In Kalaburagi itself, the total number of deaths now increasing. The total number of cases coming to light from there have also increased. This also, of course, means that the police officials will have to ensure that the lockdown is also enforced in a more stringent manner. The first leg of the lockdown will come to an end tomorrow officially. Even if it is extended in a partial manner, the officials need to ensure that the situation comes under control. Today itself, from Karnataka, we've seen 15 new cases that have come to light. Yesterday, we saw 17 cases that had come to light in 24 hours, which was the highest spike in 1 day for Karnataka. So things look quite grim for Karnataka at this point. Severe acute respiratory illness is something that the health officials will be looking at as well. In the cases that have come to light today itself, another case being reported, and these are the high-risk category patients who will have to be monitored continuously. They're also at a higher risk of succumbing to COVID-19. So this has been the biggest challenge for the health department officials as well, and that's something that they would be looking at, Adarsh.